Okay, this is an ECG of a 25 years old male who presented to emergency with complaints of palpitations for the few hours. This ECG was taken during the episode of palpitations. Now let's decipher this ECG. First of all, we need to see, is this a tachycardia? Yes, this is a tachycardia because the rate is more than 100 beats per minute. Now the next question arises, is this some sinus tachycardia that is going on or some genuine tachyarrhythmia which needs to be managed timely? For that we need to look at few things. Now let's see the ECG in detail. To start with, first of all, we need to define the tachycardia is a narrow complex or a broad complex. So in this case, this is a narrow complex tachycardia, and we can see these narrow QRS complexes, which are pretty obvious over here in all the leads. Next point is the tachycardia regular or irregular? Now this again leads to some differentials by categorizing the tachycardia regularity. So this is very clear cut regular tachycardia, and we can see QRS complexes that are pretty much at the same time, and there is no obviously gross variation in the cycle lengths or the rate of these ventricle complexes. So this is a pretty regular narrow complex tachycardia so far. The rate is around 210 beats per minute. Now this seems to be a pretty fast tachycardia. So whenever there is a very fast tachycardia, we need to look at certain complexes very carefully, and one of them is the P waves. Now what we can see on the ECG, are there any clear-cut P waves visible or not? So I have zoomed in one of the leads to identify these P waves. We can see that the QRS complexes, although they are very clearly seen, and we can also see the T waves, but we cannot see an obvious P waves. Okay, so we have to see the P waves in all the leads, and the best leads to see the P waves are lead 2, limb lead 2, and the lead V1. So this is one of the zoom in view of the long lead 2, and we cannot see obvious P waves. So what does this mean? Are there any P waves present or not? And is it sinus tachycardia or not? So no visible P waves are present. So summarizing the findings, narrow complex regular tachycardia with such a fast rate and no obvious P waves. So if we cannot see the P waves, then it cannot be a sinus tachycardia. And also remember that with such a fast heart rate of 210 beats per minute, the sinus tachycardia will be very unlikely. Now, is it some arrhythmia going on? Yes. So what can this arrhythmia be? This is a type of an SVT or supraventricular tachycardia. This is that tachycardia which arises in the atria around the AV node. So there are three types of SVTs. It can be Avnrt, AVRT, or atrial tachycardia. So remember that whenever we cannot see a clear-cut P waves, seeing all the leads, both the limb and the chest leads, then the possibility of AVNRT is very likely. And this patient was having actually a AVNRT or atrioventricular nodal tachycardia, and this is one of a common tachyarrhythmia that is seen in clinical practice, especially in young healthy adults. Now let's discuss some clinical pulse. AVNRT is a type of an SVT that is seen because of a re-entry circuit around the AV node. This is the area of the AV node, and we can see a re-entry circuit over here, this circle moving around, and because of this firing that is going all around this area, this produces what we see on the ECG. This is one of the commonest arrhythmia of SVT that can be seen in clinical practice. The rate is 150 to 220 or even faster than that. It has an abrupt onset and abrupt offset. Now this is a point that differentiate from this tachycardia, the sinus tachycardia. So for a sinus tachycardia, it has to be a gradual onset and offset, and along with that, the P wave usually follows the QRS complex. But this is not the case in the case of Avnrt, as we have seen it previously. There was no P wave visible because these P waves were actually present within this QRS complexes and that were not seen. The P waves, if they are seen, they are usually seen at the end of the QRS complexes. So if you can see a P wave or without a P wave, in both cases, Avnrt is a possibility. So these are the learning points for today.